want to welcome everyone to this important conversation about the impact of racism on mental health. For the best experience in watching this episode, please join us via Zoom, the app, or via YouTube. Hi, my name is Dr. Christina Connolly, and I am the Director of the Division of Psychological Services for MCPS. This will be a continuation of our conversation on June the 30th. Talking about mental health as a community is very important. We need to normalize this conversation in our community. Due to stigma, too many individuals of color do not seek the mental health support, nor do they have the correct diagnosis to receive the support that they need. I have seen those who experience childhood trauma engage in domestic violence, and I have also seen students who did not receive the mental health support that they needed have ended up within our prison systems. This cycle must end. We know that people may have additional questions about mental health topics. Please go to our Waymaking special website for the link to the Waymaking videos that cover a variety of mental health topics, including stress and anxiety, suicide prevention, sleep management, domestic violence, child abuse, and many more. The website will also have links to community resources and therapists of color. On June 30th, we started off with a conversation on the barriers and stigma that prevents communities of color from participating in mental health support. Today, we are going to end with a conversation on how to eliminate barriers to access and increase opportunities for receiving mental health support. The video from last week's show can be found on YouTube on the MCPS TV page. Next, let's hear a welcome from our Superintendent of Schools.
When my wife and I were about 40 years old, so over 20 years ago, we adopted two boys, biological brothers from Bulgaria. They were 7 and 9. We had our 3 birth children. We added our 2 new sons to the family and the 5 children. The older of our 2 sons, as he grew, by the time he was about 17, he was really struggling with some mental health situations. He had been 5 when he had been put in the orphanage. He remembered his earliest years. It was a very difficult time for my family, for our son, for Gail, my wife. And I remember how thankful we were to have supports and to help us get back on track with our son and to help him really come through that experience of bonding with us and of dealing with his past life experiences before he joined our family. And that it's just critically important that we focus on the well-being of every student, that we have the supports and understanding, and that we understand the intersection of structural racism, systematic racism, institutional racism, and how those things, as well as individual events and situations in our life, can really affect the mental health of our students, especially many of our students of color, as they work their way through the school system. We hope that everyone who joins this virtual Waymaking special on the impact of racism and mental health will listen and will learn. We hope that parts 1 and 2 meet your needs as we do this series and other Waymaking videos. They can all be found on our website and online. MCPS is committed to our equity work, and we encourage everyone to continue the work on eliminating racism, implicit bias, and understanding how privilege does impact the everyday lives of every person. We thank you for joining this conversation. We know it's critically important. We know that as we do this work together, we can better support the well-being of all students. We can better support the academic progress of all students. We can continue to be the excellent school system that MCPS has been for so long. And we can also become a more equitable system that is more conscious of those barriers, of the structural and systematic racism, and of the ways that we expect students to perform and how we expect them to do, how we treat them, how we respond to them, how we create access, opportunity, and ultimately success.
Now, we will hear a welcome from our Chief of Teaching, Learning, and Schools.
Hi, my name is Janet Wilson, and I serve as the Chief of Teaching, Learning, and Schools. And I'd like to share who I am as a person and my role in helping to dismantle the barriers that contribute to institutional racism. As a young child, I experienced the death of my father, which catapulted my family into situational poverty. I know what it is to experience trauma as a child and need caring adults to understand. We will open the 2021 school year in an unprecedented way. We all have heavy hearts carrying the weight of the health and safety concerns. Compounding this weight is the pervasive presence and interconnectedness of institutional racism, hate bias incidences, and social injustices that are magnified now more than ever, which must serve to ignite and unite our shared work. It takes an all-in attitude and culture to combat institutional racism. But first, we must be willing to see the evidence with our hearts and minds. Evidence which strongly suggests that our actions aren't aligned with our words when we address equity. Dismantling barriers is the work of every office and every school, and MCPS is focusing its attention on the evidence which comes from intimately connected hard and soft data. Soft data gleaned from student surveys and voice data is a form of outcome data revealing the devastating results of institutional practices and structures that we haven't been challenged in every aspect of our work. Let me provide two examples. Our hard assessment data reveal that Black and Brown students and poor students who have the same levels of performance as their peers are not always provided the same learning opportunities. Second, our data reveals that a more thoughtful approach is needed when assigning students who have high levels of need with a teacher who is an expert in meeting those needs. One way we are addressing these barriers is creating data stories that allow school teams to examine their practices and structures, leading to real and lasting change. Now more than ever is the time to examine practices and structures, especially at a time when our teaching and learning and the relationships cultivated by that exchange will have a distant feel. Now is the time to understand the impact of the variety of circumstances our students are living and will bring to the learning environment, whether in person or remote. Our hearts and minds have to see evidence of performance, mental health concerns, and racial barriers, and more importantly, act on it in appropriate and courageous ways.
Good evening, everyone. My name is John Landsman. I'm the coordinator of the Study Circles program in the Equity Initiatives Unit, and I'll be co-facilitating tonight with Dr. Conley. Today, we will talk about what institutions can do to break down barriers and what individuals can do to access services. Our session tonight is divided into 3 parts: 2 different panel discussions, and then a period for questions and answers. The first panel discussion will focus on how to eliminate barriers to access and receive quality mental health services. The second panel discussion will focus on increasing opportunities for people of color to receive quality mental health services. We will also be interspersing videos of members of our community talking about their experiences and perspectives on racism and mental health. Throughout, you can post your questions in the Q&A box. 2 of our colleagues will compile the questions so that the panelists can respond to the questions in the 3rd section of the program. So with that, I'm going to turn it back over to Dr. Connolly, who will introduce the first panel.
All right, so thank you, John. So tonight we'll begin by talking about destigmatizing the need for services and discuss the type of support available for people of color to access mental health services. So now let's get started in introducing everybody. So first we have Mr. Perry Chan, who is the program manager for the Asian American Health Initiative, or AAIH, of Montgomery County Department of Health and Human Services. In this position, He provides leadership on achieving equity and eliminating disparities for Asian Americans in Montgomery County. His duties include planning, development, and implementation and evaluation of AAHI's programs. Next, we have Dr. Celeste Malone, who is an associate professor and coordinator of the school psychology program at Howard University. Her research focuses on diversity issues embedded in the training and practice of school psychology, with a focus on the relationship between culturally responsive practices and pre-K through 12 student outcomes. And then next, we have Ms. Monica Martin, who is the administrator for the Child Adolescent School and Community-Based Services in the Montgomery County Department of Health and Human Services. She's overseeing partnerships with MCPS, such as Linkages to Learning, which provides integrated mental health, social services, community engagement, and education supports in 29 school communities highly impacted by poverty. So my first question goes into, so there's a lot of misinformation in communities of color that stigmatize the need for mental health. So now I've heard folks talking about how, therapy is for crazy people, that, people of color are strong. We survived slavery, or we survived the immigration process or internment camps. So we don't need mental health care because of that. And so people go to the doctor, right, if they break their arm, or let's say they're having problems because they have a heart condition, but they do not know when they are having concerns with another organ of their body, the brain. So my first question goes into, so what are some of the racial and cultural barriers for individuals of color to access or seek out mental health support? Plus, what are some of the signs that someone or their family member is in need of mental health support?
So I guess I'll go ahead and start. And thank you for having me here today. I'm pleased to participate on this panel. And to directly answer your question, I think that it goes into how do we describe and talk about mental health problems, because there's a lot of issues and challenges that we may encounter as people of color, but it's labeled as, well, someone is just not right, or they just work, that they're just full of worry, and how we describe it and talk about it. And so at first, we're not even recognizing that these are legitimately mental health problems. And so part of it is the language that we use. And because we aren't using the same language that our health providers do, we're not even communicating with our doctors to get a better sense of when something may rise to the attention to merit mental health treatment. And then the other part of it is just what you described, that these issues have been prevalent, but again, they've also been somewhat normalized, that people are anxious, people are worried. Why do you have to do something about it? Suck it up and get over it. And so it's part of the language that we use for mental health problems, that disconnect, as well as just not recognizing when we need to get help, even though we're having a harder time functioning in our day-to-day lives.
Yeah, absolutely. I mean, I would add to that in terms of language. We hear people talk about other people as if a mental health condition identifies who they are, period, as a person, right? We hear about a schizophrenic or a bipolar person, or someone who may have a mental health condition that is a severe mental illness, but that is not the whole of who they are. And so as a culture, and just in our language in general, and also certain semantics that we have within communities of color, we are inadvertently, many of us all the time, contributing to the stigma that keeps many of us away from reaching out and even acknowledging that there's a mental health condition.
To me, from the community standpoint, I wanted to share some hard data. In Montgomery County, we have a large population of immigrants. For example, in Asian American communities, about 22% of the household who do not speak English as their first language, and about 70% of the Asian Americans are immigrant, meaning that they are born outside the United States. So understanding the community background is important to address the barrier because first of all, many of them, they are not familiar with the US healthcare system. They don't know how to get coverage, how to use insurance, how to find a provider. And mental health in many communities, they don't even have a word to describe it. It's not a physical disease where you are able to see a doctor. So people are confused, their literacy level problem. And on top of those, there's also, same as many communities, mental health is a big stigma for the community. I just want to concur Dr. Conley talking about, mental health. Many people think they are just crazy. And in the Asian American community, people think, they may be bad mood, they don't need help. There's a lot of stigma and misconception about mental health.
Right. And so, go ahead.
Oh no, because because hearing the issue about the second language and not being able to find providers that could actually communicate with you is a significant barrier. And it speaks broadly to the lack of racial, ethnic, and linguistic diversity in our mental health providers. And so when you have a person of color that is feeling the need and decides to seek mental health treatment, they're often looking for providers of color because of that shared sense of commonality that they will understand what I'm going through, and not just the symptoms themselves, but the lived experiences that I have being a woman, being a Black woman, navigating in the United States, particularly in this context, all of these issues that people of color often bring to therapy, that it's not just us as individuals, but our cultural backgrounds and our experiences come along with us. And so wanting to seek a provider that is of the same racial ethnic background, but there are very few out there. And so that's also a deterrent, trying to find those providers. And then if you go to a provider who is of a different race or background, predominantly looking at white mental health providers, there's a fear of microaggressions. That is someone going to actually dismiss the experience that I have, not take me as seriously, be dismissive. And there's so much research about it, which shuts the door for mental health treatment. So even when someone is interested in going, having one visit with a providers being very dismissive and not using culturally responsive practices, and that turns the person off to mental health treatment and compounds that stigma and gets other people in their community to shy away from it because they hear about those stories.
I totally agree. And that also, in addition to language, that also speaks to the trust with the provider and how familiar our community understand the treatment. And another things that I see from the research is that not only people have low utilization of mental health services when they need it, but they also have a very high dropout rate, meaning that they do not complete the entire treatment program and they drop out in between. So that prevents them from achieving their best outcome of the treatment. And that makes me think, do they understand the treatment? Do they know what is going on? And some people do not trust counseling or talk therapy. They just think that, by talking, how is it going to help me with my mental health condition? So a lot of education, prevention, outreach, building trust, helping people understand what is mental health and what is the process will look like, who are the providers. Those are the things that we need to look into more.
Right.
Unfortunately, we have quite a history in this country, quite a history of that lack of cultural competence leading to not just lack of treatment or disengagement in treatment, but misdiagnosis and inadequate treatment. And that has only harmed the ability for our mental health community and many of our communities of color to connect and to get better results for everyone. And thinking about that whole treatment plan, we need culturally competent providers of all languages and colors, but who also, regardless of the language and color, are constantly thinking about learning from their patients or clients or whomever they're consulting with about the whole person before even thinking about starting with some of the basics of a mental health assessment. Because when I come to a provider and my traditional healing practices from my community or culture, are dismissed or not even asked about, or my spirituality is not something that I can bring into that interaction, then automatically you know, you're peeling away pieces of my identity that are part of what I need to express to you in order to be engaged with you around the mental health issues that I'm experiencing.
Yeah,
Right.
and that's such a great point with regards to the misdiagnosis piece, that because all of the factors of a person, all of the cultural backgrounds that they bring, their overall humanity isn't taken into consideration. Misdiagnoses occur, which affect the course of treatment, because if we don't have a really good diagnosis, that does affect how we would proceed with regards to therapy. And we see it in community providers. We also see it with regards to school settings, that people of color tend to get more severe mental health diagnoses, even when they're not necessarily merited. And thinking from a school-based context, the harm that it causes. So for example, Black and Latinx kids are diagnosed with autism spectrum disorder at a much later age than their white counterparts. And so they're more often identified as having like oppositional defiant disorder or some type of behavioral problem without recognizing that it's a developmental issue. And as a result, they're not getting the support, that an early intervention that they need that can change life outcomes. And so it, just like was mentioned, it's twofold, that we do need more diversity, racial, ethnic, and linguistic diversity in our mental health providers. We need all mental health providers to practice within a lens of cultural humility and utilize culturally responsive practices. Because if we're getting people, if people are getting turned off from mental health treatment and not seeking it out, that causes harm. But when we're misdiagnosing and not really treating the problems, that causes harm also. And so we really do need to address it from both ends.
Right. And so, and I'm listening to the three of you, and there's just so many themes, important themes that have come about. And so, especially for our audience members that are watching. So number one, if you're a student and you're looking for like, what type of career do I need to go into? You know, hey, look for mental health. We got a job available in MCPS. And once you graduate, you want to come be a school psychologist, come, because we need some folks. And two, that the need for the culturally responsive training for our mental health providers is key. And we're looking at for all providers that are providing support and services in schools. And so while here at MCPS, we have school psychologists, we have school counselors, we have school social workers, and those of us who have this training in terms of providing the individual and group counseling that we can provide for students in our schools. And we have to come from this culturally responsive lens. And we're lucky in MCPS where we do have counselors, social workers, psychologists who do speak other languages. And so, but unfortunately, we don't have enough to go around, you know, for every school in the county. But for those schools that do have one, it's an extreme benefit for them, so that we can have folks who can break down some of those barriers. And we do try to use our resources like many of our community agencies, like within the DHHS, our services like through linkages to learning that can also then provide supports to our families. So all those things, all those things that you brought up are so incredibly, incredibly important. And so, and I want to go back into a little more of what Dr. Malone was discussing in terms of, so I want to look at, so what are the negative impacts of not receiving mental health support for our students and our families when it's needed?
All kinds of negative outcomes. So even if you think about when you get a cut on your hand or some part of your body and you don't treat it, it runs the risk of getting infected. And that infection, you may lose a limb, and because it could get that bad. It's similar to mental health problems as well, because our mental health is so deeply connected to our physical well-being. And so when we're not addressing our mental health problems, certainly has a relationship on our physical health outcomes, but then also other life trajectories. So from a school-based perspective, kids with untreated mental health problems are more likely to feel disconnected from school, so more disengaged, not that lack of school climate or not having positive perceptions of school climate, which also has a relationship to academic performance, to behavioral outcomes in school, which has long-term consequences for if they complete school and then looking at jobs and in the future. And so it's so vitally important that we recognize and address youth mental health and building the infrastructure to address it in school, because it's so closely tied to academic and school outcomes. And we see similar patterns with adults as well.
And much like any other kind of, medical conditions or just health and wellness awareness, education and challenges that humans experience, the earlier that you address anything, the easier it is to have the most likely a preferable result. And we know that developmentally, children's brains are changing all the time. We have these wonderful pliable brains throughout our lifespans. We absolutely do. But developmentally, there are pockets and there are times where they're pliable in different ways. And so when we miss opportunities to identify for ourselves, for our students, for our loved ones, and or support those that are having mental health symptoms or challenges at any point of those stages, we are missing some opportunities to improve lives right now, right? Not 10 years from now. And that has a ripple effect on all of us.
Well, I totally agree. I think in addition to what the two panelists well said, and I think it's also important to look at what caused the institutional racism. I think it's equally important to understand the reason. Such some policy issues such as, public charge, and then some cultural issue. I have heard from the community that because they feel shame to use public services. They don't want to engage with public assistance. So those are the factors that I think it is important to go to the root cause and what are the factors causing these barriers.
Yeah, and I'm glad you mentioned the point about racism, because as was discussed last week, there's such a deep connection between racism and mental health, and race and physical health as well, that racism is literally killing people of color. And when we think about the health outcomes and the poor health outcomes associated with it, the lack of access to treatment, the chronic stress that is caused by the environment that we're living in right now due to institutional and structural racism, that we have this chronic stress effect. And so as our bodies are experiencing this chronic stress, we're more on edge, we're more irritable, it affects our mood, it affects our blood pressure. It's this whole overall spiral. And so to Perry's point that absolutely we have to address symptoms rather. But as mental health providers, it's important for us to engage in advocacy and build alliances with communities to ultimately address the root problem, because we could teach someone skills to adapt and how to manage and navigate racist situations, how to effectively respond, but they're still in that toxic environment, which is going to cause this ongoing stress. And so we absolutely have to consider it. And then thinking about how, when we look more so at school-based outcomes and learning more about the impact of racism on kids, that it's a recent study found that explains as much as depression symptoms with regards to suicidal ideation, experiences of racism and discrimination. And so and providers need to understand and probe for these issues, and not just think about the symptom checklist, but consider the broader context in which our clients live, so that we better understand and can conceptualize their problems and help to treat them.
Yeah, and we really can't do that effectively without thinking about, trauma, because racism is traumatic, right? Any experience, whether it's micro or major or otherwise, it is a traumatic experience. And again, thinking developmentally about the fact that when kids at young ages learn about what trauma is and how it impacts them and how it impacts their brain and what they can do about it and how they can reach out. We may not be able to curtail every other traumatic experience they have in their life, but the earlier that anyone has an experience of addressing and succeeding and also reaching out and utilizing their community, their network, whether it's their school, their family, their church, to support them with that, the more we're able to build on that resiliency and to mitigate the impact of trauma over the lifespan.
And to me, racism could be intentional or unintentional. I also think that in many of us who are working in the public system, I think with the county having a conversation about equity, I think it would create opportunity for us to look back and ask ourselves, what are we doing? How can we do better? Is our program policy infrastructure set up in a way that is tailored to the needs of our community and our target audience, and trying to avoid one size fits all the type of approach? I think those are the things that we should take a step back and review what we have been doing. We need all of us in the public system to engage into this kind of dialogue.
Yeah. And I think, as you mentioned, racism, we can't neglect the fact that racism also shapes access to mental health service. Mm-hmm. And so where can you find providers? Where providers are located, that's very much a result of structural racism. And so, as was mentioned before, I'm Howard University in DC. And if we look at how child mental health providers are distributed in Washington, DC, if you look in Ward 7 and 8, east of the Anacostia River, it's very hard to find providers. But if you go to upper Northwest DC, you could find a psychologist who is charging out of pocket. You got to pay out of pocket, but you could find them everywhere. And so when we think about the barriers to access, just the sheer number of providers, the lack of culturally responsive providers or providers of color, and then those barriers to actually getting to treatment when you're interested in doing so, that you may not be able to find someone within your community or takes insurance. And that's all an impact of structural racism as well.
Right. And we experience that here in Montgomery County as well, because we know that there are pockets in certain areas of the county where there are no mental health providers. And so when you look at some of our wealthier areas, let's say in like Bethesda, Potomac, you have lots of providers because they can bill parents and they can pay cash for that. They don't have to worry about billing private insurance because many providers don't want to go through the paperwork. And so then what happens to our communities that are impoverished, our communities that are in areas where they don't have enough providers? So let's say you go into some of our rural areas, like up in Damascus or in Poolesville, in Silver Spring, up county in like Germantown, areas of Gaithersburg. Gaithersburg has some, but there in some areas, like there just aren't, Burtonsville, there aren't places for people to go receive support. And so we know that the majority of students in our country receive their mental health services in schools. And so this is why we continually try to advocate for the addition of mental health providers like school psychologists, school counselors, social workers within our schools, and try to increase them in our budget each year. Like we know that our ratios of school psychologists is one of the worst in the state, unfortunately. Our school elementary counselor ratio is really high above the national average. And we know we're in a pandemic. We know we are in tough economic times, and we know that for the budget year, the positions that MCPS put into the budget were not approved by the county council due to budget issues, just due to the pandemic. And so we're hopeful that those positions will be added for next year. But what can we do to make sure that we are increasing the amount of services that are within the community, especially for our families, for our parents and guardians, and then for our students? Because we know, and especially one of my biggest concerns right now is that when we go back to school and students who have experienced the images of racial injustice, police brutality, all these things have been going on in the news. And then on top of that, you have, because that, mind you, I don't see on top of that, because that's been going on for a long time. Mm-hmm. But seeing it, it was kind of like this feeling of just being a person of color, I'm like, I'm not well from watching this. But then you have the pandemic on top of it. How are students going to be able to go back, sit on a computer screen or in a hybrid environment in a chair, watching their teacher and being able to learn English and algebra again when they are struggling with all these things that have been going on? Because we know some families, I mean, I'm hearing stories from some of my psychologists of students who have lost both of their parents due to COVID-19. So they're coming back from that trauma, and then we're going back to school. And many other things. So what can we do? How are we going to continue to be able to provide the support? And because we know that, especially if you are an individual who can't afford to pay out of pocket for those services, because again, like I might be middle class, but I just can't come out and pay for a provider. Like I don't make that much money. Not to say, and there are others who make a significantly less than me. And if I can struggle with that, what about those who have even less? What about the issues with those, again, in poverty? And we have our linkages program that are within many of our schools, but it's not in all. And it's not able to, we have 208 schools in MCPS, and we provide that support, what, Monica, it's like 28, 29 schools. So, you know, what are the things that we need to continue to do in order to continue to support this? So, and I know as we got to keep moving on into our next segment of the presentation, but I do want to thank all of my panelists here for this conversation. In a couple of minutes, we're going to introduce our next set of panelists. Dr. Malone, Ms. Martin, and Mr. Chan will be back for our question and answer period later in this forum.
My name is Jeff Donald. I am the mindfulness coordinator for Montgomery County Public Schools, and I'm also an artist. I wanted to somehow, through my art, be able to show coming from darkness into light through the inner work that we all must do in terms of mental health and in terms of the new age that we are entering. The piece itself is called Ascension. The dark background is representing, you know, this inner darkness that we can find ourselves in. And the bright colors signify these higher parts of ourselves that we can attain when we are right here and here. And mental health, mindfulness, all of these other pieces that are so important to our overall life are often stigmatized, and we just have to get past that.
A lot of the kids who have, you know, trauma in their lives, they, as you said, educators don't want to deal with the trauma, be it in the classroom, educators, teachers, or the principals. They're like, you know, I just don't want to deal with it. It's hard, and I'm going to exclude them and put them in either, you know, the behavioral disorder programs or some other things. And, you know, we know there's a disparity in Montgomery County. It's yet another stressor on top of police brutality, on top of income inequality, on top of being, you know, last hired, first fired, on top of having no wealth, no cushion to fall on when you lose your job. Now you're, you know, you're a month or two from being homeless, and you know, on and on and on. The compounding effect of these disparities is enormous on as trauma both to adults and to the children.
My name is Michelle Palmer. I'm the coordinator for the Division of Psychological Services, but for 20 years prior to that position, I worked as a school psychologist in multiple MCPS schools. I grew up thinking that everyone was equal and was capable of doing and achieving pretty much whatever they wanted, including me, even though I was a girl. My parents instilled that in me. They expected me to work hard and succeed. We didn't talk about race, not because we were afraid to, but because race wasn't an issue. It was the post-civil rights era, and we were taught to be colorblind. Now, that issue of being colorblind, that's what white people used for many years to say that we weren't racist. It's an insidious concept because it denies the importance of race. I didn't necessarily know that until I was an adult. I spent a lot of years, however unwittingly, contributing to systemic racism. just by not recognizing my privilege. And I would be in discussions at our EMT meetings where Black and Brown students or English language learners were being discussed, okay? I would watch the body language of the parents of color when the mostly white staff would talk about how poorly their children were doing in school, academically or behaviorally. Assumptions would be made about the students too. Well, you know our kids won't be able to do this, or we have to test them and get them into special education, or they won't get the help they need. I remember early in my career having sort of an uneasy feeling in the pit of my stomach when people said these kinds of things. If you're having that kind of feeling in the pit of your stomach, something's wrong. Something needs to stop. Something needs to change. That's a warning sign to you that you need to challenge what's being said.
Hello, my name is Dr. Torres Simpson, and I'm a school psychologist in Montgomery County Public Schools. Mental health and racism have been tied for a long time for the Black community. Oftentimes, people in the Black community would have a really hard time in medical field and with other professions really believing what we were saying or even practicing on us. So a lot of people in the Black community do not trust a lot of mental health professionals, medical professionals as a whole, but that is not helping our young people. Our young people are dying from suicide because of mental health needs. Racism is trauma. They are being traumatized. They need to have some way and learn some skills on how to cope with that trauma so that they do not take their lives, because we are losing generations of students right now. We are really losing our kids, and we have to give them the resources needed in order to cope with what's going on.
Our last panel and the folks in the videos covered a lot of important issues, and we're gonna bring it now to looking at how can we increase opportunities and access right here in Montgomery County and Montgomery County schools. So I have the pleasure of introducing our next panel. I'm going to begin with Mr. Nick Asante, who's a senior at Richard Montgomery High School and was elected to the student member of the board for the 2020-2021 school year. He recently served as the chief of staff for the Montgomery County Regional Student Government Association. Welcome, Nick, and congratulations. Next, I'd like to introduce Dr. Daryl Howard, who's an equity instructional specialist and former school counselor in MCPS. His work and research interests include the study of cultural competency, race and ethnicity, and social emotional learning in education spaces. He is instrumental in the work of the Building Our Network of Diversity project, where he leads initiatives focused on the recruitment, development, and retention of male educators of color. Dr. Howard is the author of Complex People, Insights at the Intersection of Black Culture and American Social Life. Welcome, Daryl. Next, I'd like to introduce Officer Joseph Lowery, who has been a Montgomery County police officer for 32 years. Past department assignments include patrol, the gang unit, special assignment team, and as an SRO at various schools for 12 years. Officer Lowery is currently assigned as a school resource officer at Quince Orchard High School. And finally, I'd like to introduce Ava Millicitz, who is a freshman at Poolsville High School and recently served as the president of Montgomery County Junior Council. So welcome, Ava. If all of you could come on, welcome, nice to see you. The last panel covered a lot of issues and barriers. I heard them talk about historic racism, institutional and structural racism currently, microaggressions, lack of cultural awareness, stigma, misdiagnosis, a lack of access, and a lack of diversity in the mental health field. We'd like to connect those issues to our school district. So I'm going to begin by asking our students a couple of questions first, and then we'll bring in our other panelists. So Nick and Ava, I spend a lot of time facilitating dialogues in MCPS around racial barriers with students and staff. In a lot of these conversations, I often hear the adults say they really want students to come and talk to them when they're having emotional or mental health issues. But just as consistently, I hear students say that they either don't feel safe talking to the adults, that their teachers don't understand them, or their counselors are not available when they actually need them. So beginning with you, Nick, and then Ava, can you talk about your experiences here at MCPS? What do you see?
First, I'd like to thank you for the congratulations towards me. And I think personally in my own experiences, I've had a pretty good experience interacting with my teachers and with my counselors when seeking mental health support. However, I know that's not the case for most of the students in the system. Most of my friends aren't able to go to their counselor and talk about their experiences, or don't have a teacher at school that they can go to and talk to about the things that they may be dealing with in their lives. And I think the big cause of this is a lot of teachers sort of establish an environment where their relationship with their students is more, I would say, professional. They're the teacher, you're the student, and you see them for 45 minutes a day. Once that class period is over, then you leave. They don't really reach out in any other way, and they don't really build that environment where you feel comfortable enough to go up to them and go talk to them about the stuff that may be going on behind the scenes. And when you are comfortable enough to talk to them about that, a lot of them tend to dismiss it as an excuse for not wanting to complete classwork or not wanting to do assignments. And it can feel very patronizing when teachers don't take your problems seriously.
Thank you. Ava, how about your experiences? What do you see?
I think overall my experiences have been really good. I think that not everyone, my friends, have really been through the same experiences. So, for example, in middle school, I guess we had a better relationship with our teachers than maybe in high school, what I've heard of. There was a closer connection. And so what happened is that in middle school, particularly in my 6th grade English class, we had these community circles. We basically shared how we felt about what's going on. We talked about mental health and things that are deemed as taboo, I guess, from within our family or with our own friend group. So the fact that we had that teacher that we looked to, our comfort space, our safe space, was really nice. I just don't think that everyone that would never have that experience in middle school, or won't have that teacher to look up to that cares for them as an individual, not just as a student in high school particularly. I also think that the issue with the videos that we see in our health class, if they don't reflect basically people that look like us. So for example, we see a lot of videos about bipolar depression, stress, anxiety in our health classes, but maybe that's a video that's mostly of white children. What if we don't see people who look like us who are dealing with the same things? And I think that maybe for me as a middle schooler who went to predominantly Latino and Asian school, there was a lot of homophobia, a lot of phobia when it comes to mental health and when it comes to believing that, oh, I deal with this too. But because I see someone who doesn't look like me, therefore I don't deal with this. And that stems with not just who we are as individuals, as students and our community, but also from our parents and from different people in our family, basically saying that, oh, you're crazy, or oh, you're not dealing with this, you're okay. This is what is normal. Well, we have to establish that it is normal, we have to seek help. And I think that's what the issue is with, I guess, the differences of generations and how we see mental health.
Great, thank you so much. Nick, go ahead.
Yeah, adding on to what Ava said, I also think with race and with the stigma of mental health, I feel like for a lot of students of color, in the classroom, you already feel less than a lot of your white peers. So you already feel like you have to prove yourself even more to your teachers. And then on top of that, having to talk to them about mental health, you're scared that that'll just diminish their already low view of you. And so that adds to the reason as to why a lot of students, especially students of color, aren't able to reach out to their teachers. They're scared of that stigma that already exists and then adding on to that stigma.
Yeah, there's a lot of pressure of not letting your guard down.
Thank you. Dr. Howard, I see you nodding your head to everything Nick and Ava are saying. Can you tell us a little bit about your experience? What do adults need to know?
Wow, that's an incredible, mature perspective that Nick and Ava both have. I appreciate your comments and your sentiments. So I think with educators, oftentimes there's a few blind spots that exist around mental health, particularly as it relates to students of color. One of those blind spots, of course, has to do with social emotional learning. That's the way I package the work that I did as a school counselor. And the idea that social emotional learning has to be culturally responsive. There are different experiences that people have based on race and culture, and the learning around self-awareness, social awareness, how to build relationships has to be contextualized from that perspective. I think another blind spot is a lot of educators do not speak and use emotion talk when speaking with students of color. And that's just an observation that I've made, not only of my own practice early on, but of other educators and counselors as well. And therefore, students of color don't use language such as stress. They don't use the words anxiety. They don't use the word depression. Most times you will see that type of behavior demonstrating kind of like a fight or flight response, where they are pushing back against something via anger, or whether they have disengaged through that flight process. But really, I think those are diagnosable things, like that's stress, that's anxiety, that's depression. Those are those things being replicated through flight and fight response. So I think folks need to be mindful of that and being able to teach students how to have a level of the language and the verbiage to be able to express how they're feeling. I don't think that that's taught enough.
Dr. Howard, we're going to move on to Officer Lowry in a minute, but I just want to ask you a quick question. You talked about that social emotional learning needs to be done through a cultural responsive way. Can you just give us an example of what that might look like?
So I think when we're talking about culturally responsive behavior or approaches, we're talking about the ways in which a student may see the world that may be different from yours. And I think that whether you are white, Latino, Black, Asian, you grew up with certain understandings of how the world operates. And when we talk about the decisions that people make, when we talk about the way they build relationships and friendships with others, it may be, some of that may be cultural behavior. And when we don't recognize that there may be some differences in the way we're interacting with folks, I think we have problems in being able, number one, to establish rapport, number one, being able to accurately see what's going on, and also being able to support them through whatever it is that they may be going through.
Great, thank you. I would like to move over to Officer Lowry for a moment and switch subjects just a little bit. In our last session last week, we got a number of questions about SROs in schools contributing to the school to prison pipeline. And I wondered if you could talk a little bit about what do schools and SROs need to do to help students get mental health support rather than entering the criminal justice system.
Thank you for that question and for the invitation today. I think this is a fantastic conversation we're all having. A couple things both the police department and the school system has done, especially around the time that the SRO program was relaunched or reborn. For those who don't know, that initially we were called EFOs, and that program, unfortunately, due to budget cuts, was cut. And so in 2013, when they revamped and the program came back, they went with the more SRO naming. So along with that name change also came how we do business as far as our relationship with the school system and the state's attorney's office. So we have a very detailed memorandum of understanding. It's gone through a couple of revisions. In fact, I think even now they're revising it. But one of the things that was different from the EFO days to the SRO days is that some of the arrests and things that would occur in schools that were mandatory arrests are no longer mandatory arrests. And that philosophy was also in MCPS as well. For instance, if you brought a knife to school, that used to be a mandatory arrest and a mandatory 10 days suspension with expulsion. We don't do that. We don't do business like that anymore. So I would say our focus has been really the pipeline to intervention. And so, for instance, if you look at, I know recently there's been some press about the number of arrests that have happened here in Montgomery County with their officers. You have to look a little carefully at the data. So it talks about 260 or 270 arrests. Well, of those arrests, only 10% were actual physical arrests. So I mentioned that to give a little background, because the positions now, certainly the last 7 years, has been that we look for diversion. Prince Orchard High School, where I've been the last 7 years, we were one of the first schools to do restorative practices. And so I've been trained in that, along with other folks who work in our building. And we do a lot of mediations. I mean, arrest is always the last thing that any officer, who works in a school building looks at. On top of that, there's been a fantastic amount of training the last 4 or 5 years for officers who work in the schools and officers in general to talk about exactly the things we're talking about today, about the mental health crisis that we're having in our community with our children and that sort of thing. And so where an officer before might have a kid that might be disruptive and do things that were, even though they met the criminal standard, instead of arresting a kid and taking them to the station, we now may work with our partners now, with our psychologists, our counseling much more carefully. With the crisis center. Also, sometimes if we're going to transport someone, instead of transporting them to the station, we would do a transport to the nearest mental health facility so that child could get emergency if it rose to that level. So it's a different change of thoughts the last 6 or 7 years since the program was revamped. And so we've been working along that line for the past 6 or 7 years. But I think with this new awareness that's what's going on in the country, with a lot of stuff that's happening and that's inappropriate that police are doing, I think it's important to understand that our agency has been kind of ahead of the curve in changing things, and we're still looking to do some additional changes as well.
Great, thank you so much for that. We're almost out of time. I heard the students talk about the lack of relationships in schools between many of the teachers and the students, specifically students of color, and also a lack of awareness, a lack of representation. So Eva talked about not seeing herself and other students of color not seeing themselves in some of the materials that we provide, especially around mental health. And Dr. Howard talked about the importance of culturally responsive social emotional learning and really doing things through a culturally responsive and racially conscious lens as we do our work. And Officer Lowry, I heard you talk about working collaboratively with the school and other health agencies and community organizations to provide services rather than school to prison pipeline. So I really appreciate all of your input. I have so many more questions for you all, but we are out of time. So we are going to move on to another set of videos from a few more people, but then you will all be back. So hopefully we can get to some more of those questions in the Q&A section. So Mr. Asante, Dr. Howard, Officer Lowry, and Ms. Milicis, thank you so much for this part, and we'll see you in a couple of minutes.
Hey, my name is Doug Rivera. I'm a school counselor at Quince Orchard High School. And some of the barriers that that I've experienced and I've listened to have been from my experience through the Minority Scholars Program and also through Bond. And hearing some of the impacts and some of the comments that teachers have made to students, and how, a lot of times these students, while we think that these comments are positive comments, a lot of these students take these home. And if we do make a mistake, and if we do or if we say something that, that's not appropriate to a student, that we have to own it and come back and tell the students, hey, I apologize. I didn't know that comment made you feel that way. I didn't think that, that they would hurt you. And a lot of times students appreciate that, and they, acknowledge the fact that, adults are also, that we all make mistakes.
My name is Acharya, and I'm a school psychologist in MCPS. We know that students are disproportionately represented in special education and in many situations face harsher disciplinary actions in schools. Many policies and procedures that lead to this disproportionate data are rooted in bias, and it is our obligation to revamp them. Our team has worked to build a standardized procedure for social emotional learning, which is inclusive of mental health, in order to provide equitable access to students, regardless of their zip code. These procedures include best practices and resources that are known to have positive outcomes for all of our students. And really, on a personal note, as a school psychologist, I have always advocated for a comprehensive role to provide school-based mental health services to all of our students, being fully aware of the fact that not all of our students have access to these services in their communities.
My name is Stephanie Sarich, and I am one of the mental health therapists with Identity Inc. At Identity, we work with Latino and Black youth who have experienced complex trauma in their past. It is important to understand that within these cultures, many parents and students believe that expressing their sadness, their anger, their loneliness has been seen as a weakness. But actually, it is normal, and it is normal to have emotions. That your emotions do not define who you are. Just talking about what is really happening, I think right now is a vital time where conversations that are very challenging are happening. And our youth want to talk about these things. They just need a door. They just need a place, a safe space where they can really just talk about what is happening within themselves.
Elementary school was a very tough time for me. And I'll never forget all the times where I experienced being bullied on the playground. It did happen. And I went to a school called Saddlebrook Elementary School. It's now a park police station. But one of those things was that just for years, I went from being a kid who came in and was doing pretty well. Then slowly, I'll never forget the time that the teacher in front of everybody said, Ed Reed, and named 2 other students, you're being moved to the smaller class. Now, all the kids in the class started laughing because amongst the kids, they said that was the class for the dummies. And I'll never forget, I cried and I cried, I ran to the back. And then as those years went by, my self-concept, my belief in my ability began to evaporate. And I reached a point, and at the end of 6th grade, I had just been teased so much, and just the understanding who I am and the value of who I am. At that time in my young mind, I decided it was time just to call it quits. And in that moment, I went and I attempted suicide. And I'll never forget, I went to Holy Cross Hospital. My older brother took me there. Everyone was going crazy. And I stayed in the hospital for about 12 hours. And so when we talk about mental health, and I reflect now that I'm older and I'm a champion for kids, but what I reflect on is I wonder what would have happened if at least one person would have said, hey, Eddie, how you doing? If they just would have said, how are you doing? You seem a little sad. Can we talk? But no one. And it wasn't until I was in 8th grade where my middle school counselor looked at my test scores and asked me the question, hey, Eddie, do you think you can handle the larger classes? And by that time, I had really checked out of school, but I said, of course I can. And I got bumped into a regular English class. You have to be able to help our young people. As an educational institution, we need to look at our curriculum and not wait for February to start showing Black history facts, but how do we teach and share the contributions of all people? And how do we challenge the stereotypes and the assumptions that people who made significant contributions don't look like me? I'm going to challenge you. Check on kids, have an honest conversation, and ask them simply, how are you doing? Build those relationships so that they can trust you. And a child who has a trusted adult has a lifeline when they need access to mental health.
Next, we want to be able to share with the audience some resources that are available for reporting incidents of discrimination that occur within our schools. So for staff members, students, and parents, anybody in the community can report any incidents of discrimination to FIRST. You can contact the building administration within your schools. They are available to support you. If you need additional assistance, you can also contact Greg Edmondson. He is the Director of Student Welfare and Compliance. He is also our Title IX Coordinator. On the screen, you will see the email address where you can contact him. You can also go on to the Safe Schools Maryland tip line. It has the phone number here. It also has a free app that is available in either of the app stores. So staff within MCPS, including myself, receive all tips, and we respond to all tips that come in. And this is an anonymous service that is available 24/7. And as well, parents and students can report bullying, harassment, or intimidation by completing the MCPS form 230-35. You can submit that form to the principal, counselor, or any school staff. So next, we're going to transition to our community questions and answers.
Good evening. My name is Shella Cherry, and I am the Director of Student Leadership and Extracurricular Activities. Also here with me today is my colleague.
Hi there, I'm Gillian Hubner, and I'm an MCPS parent of a high schooler and a middle school student, and I'm also the chair of the Montgomery County Council of PTA's Committee on School Climate and Safety.
We're very glad that all of you are here. You all gave us lots of questions, and hopefully we'll get through as many of them as possible. But please be assured that we are saving all the questions and the comments that were submitted to us this evening. We will be reviewing them after the show and using them to inform our next steps, and of course always informing our work. As we go through these questions, we've tried to kind of look at some themes here for you, and so at this time we'd like to ask all of our panelists to please come back onto the screen, and Gillian will start with our first question.
Yeah, so many good questions coming in, so I hope we get to as many of them as we can. The first one is, do you believe that the biases surrounding the mental health field are the primary factor that even people who have access to therapy avoid it?
Yes, as a short answer to that, because of the way that we talk about mental health treatment, the fact that it's so much more challenging to access mental health treatment as opposed to physical health treatment sends a powerful message about what priority mental health is within this country. The language that we use, that we toss around terms such as crazy to describe situations and people all the time. And so even the language that's associated with mental health conditions, we use it disparagingly and we use it as insults. And so people are understandably concerned about having those labels attached to them, and especially thinking about how it impacts their life outcomes and trajectories. That will this be on my record? Will this be in my medical file? Who will have access to it because of all the stigma attached to it from our communities, our families, but then our society writ large? That's a significant barrier that we need to address, and conversations like this help.
Thank you. There was a question that was submitted this evening, and it says, many schools don't have the space to provide for students to receive mental health services at school. What is MCPS doing about this? And I actually wanted to address this question to our student leaders. What have you heard from your peers about the need, and what do you advocate for in terms of suggesting certain things for MCPS to do in response to this?
One thing that I heard a lot throughout my campaign for student member of the board was a lot of students complaining about the fact that there was no designated space within their school to go and de-stress or to have an adult to talk to. And so I think it's really important that schools establish, whether it be a classroom or a place within their school building where students can check into as needed for mental health support, because like we mentioned, the counselor's office is oftentimes busy and it's hard, or it can feel awkward to reach out to your teachers. So for a lot of students, there is no place in the school building where they do feel comfortable getting that mental health support. The only support they're getting from school is a lot of their other friends who are also going through their own issues and problems.
Thank you for that, Nick. Can we talk a little bit about the stress that's created by model minority expectations on Asian students and the racism that they experience because of the same?
Sure. So let me take a second to explain what is model minority myth. As it's called, it's a stereotype that people think the members of Asian American communities are wealthy, healthy, they're well off, they don't need any help, they are highly educated, they are the top group of in the social classes. So to me, it is as I said, it is a stereotype, it is a myth, people, and what construct to this model minority myth is also caused by a structural racism, which is the lack of data. For the Asian American communities, extremely diverse. There's over 50 there's over 50 ethnic groups speaking over 100 languages and dialects. So the data is lumping everyone together in the Asian American community that create a picture saying that Asian are wealthy and do not need help, basically. So the stress of it is, making people think, oh, Asian students are all good at math. They are all good at science. They will be either a doctor or engineer in the future, which is not the case. So if you are an Asian student and fall into one of those categories, and you have to be a doctor, you have to be an engineer. And if you're not, that would create a stress that why am I in minority? Why people are looking at me that I can be an artist, I can be on TV show, I can be a journalist, which, that, and then on top of it, we are also looking at a lot of social determinant of health from the poverty, and from our health needs assessment, it also address some high academic expectation from the family, etc., etc. So all this compound together make a very stressful environment for this type of, this group of students.
Thank you, Mr. Chan. There was a comment that was shared last time in our first session, sharing that there was some kind of survey done, and that a great portion of the students that had taken the survey shared that at some point in time, they had either felt depressed or felt anxiety, and maybe even some suicidal thoughts. And we all just recently heard that very powerful last video from one of our MCPS colleagues. I'd like to ask the panels, whoever feels most comfortable to share, what systems can be put into place to more clearly identify any of these students at risk, whatever the particular concern, depression, anxiety, or suicidal thoughts?
I'll just say first, I think one of the most powerful systems that can be put in is a peer system. As we've heard some of the students say, peers are often the first place that they go to confide in and share, or the first observers of challenges that their friends are having in the environment. And so there's a number of peer programs. I know there's some at MCPS. I've heard of several where there are peer ambassadors or peer mentors that do outreach and education around mental health issues and that make themselves available to their school community for questions and consultation. So I don't know if any of our students here on the panel may have participated in any of those and have some specific examples, but I would say first and foremost, if we can create the space for that to happen in our school communities, even with our youngest students as well. This is not something that is only to be done in high schools with adolescents. Social emotional learning happens throughout the lifespan and needs to be supported in our schools as a safe place for our kids to be able to talk with each other and learn how to seek out adult help as well.
And I think Oh, can I just
Go
add
ahead, no,
something real
please.
quick to what Monica says? So, MCPS has the Signs of Suicide Prevention Program for all of our secondary schools, 6th through 12th grade. And in there, it teaches kids how to act, how to acknowledge their friends' feelings, how to care, and how to tell a trusted adult. And so within that model, we just want to make sure that we are encouraging all of our students as, you know, because we know adolescents, a lot of times they go and they talk to their friends about issues that they're having, and sometimes they feel more comfortable talking to their friends than to another adult. So please, when your friends are sharing some of these mental health concerns or even thoughts of suicide, that you need to share them with an adult. Please make sure to go tell your parents, your guardians, tell other family members, tell somebody in the school, your counselors. All of your schools have assigned school psychologists. Most folks don't know that, yes, they have assigned school psychologists. And you can go and find these people and talk to them to go and get your friends help. So, because we do understand that, you know, especially for older kids, that's what they talk to their friends. They have cell phones, they text, that's what they do. And so for younger kids, you know, make sure to go talk to your teacher, go talk to others, your parents, your guardians, and others in the school to share these things that are going on.
Can I share a personal testimony with that experience? I know last year, my sophomore year, I was like talking to my friends a lot, and we were talking about like all the stresses about life that we were facing. And then one of my friends actually reached out to my counselor and asked them to check in on me. And although it was not nothing serious, I really did enjoy that conversation I had with my counselor. And now me and my counselor have a really strong relationship, and we're constantly talking about what's going on within my life. And I really appreciate the fact that my friend reached out to my counselor for me, because that was something that I was a little apprehensive about to begin with.
Yeah, and I also want to highlight the importance of teachers as well. And so that was commented on that last video that we saw, that if the teacher or if a teacher had just checked in. And so for a lot of students, and as Nick pointed out, they may not want to go to the counselor or may not know how to access the counselor. The counselor's office is busy and full, you know, that stigma attached to it. But teachers interact with students every day. However, in a lot of our teacher preparation programs, we have little talk about emotional behavior problems, special education in general, but never mind about psychological issues. And so helping teachers get a better sense of what to look for, that the child who is having a behavior outburst, it could very much be depression or anxiety. It's not that they're just being annoying. It's not that they're being oppositional or defiant, but really helping teachers be psychologically minded. And so some of the work that we're doing at Howard University, I consult regularly with our teacher education programs and provide some modules to those pre-service teacher candidates, as well as doing outreach and professional development to instructional staff, because those are the first lines that they may not make it to the counselor or the psychologist, but they're with teachers every day.
That's a great setup for the next question. I think I'm going to try to blend a few here, but there's this interest in teachers getting more training so that they develop some fluency in how to show up in a socially, emotionally intelligent way themselves. But also the relationship between the teacher, the counselor, and the parent, and how so much of that revolves around discipline. So a parent may not hear from a teacher unless there's a discipline problem. So how can we create some sort of interaction between the parent or the counselor and the teacher to make sure that the conversation is always about social emotional well-being before it's about discipline?
I'll try that one. So I think in thinking about my time as a school counselor, and Nick brought up a good point about how counselors a lot of times check in when they hear certain things about students. In his case, he said it wasn't severe, but it was nice to have someone check in. I think just the idea of being able to connect with that person in the school, and if it does appear to be something more than what was reported, having the space to be able to reach out to parents and share what those concerns are. I don't believe that teachers feel comfortable with that, and that's not a fault of their own. As Celeste mentioned, they're not really trained for that. I do think that there should be some general protocol around just being a human and just being able to say, I think students learn from teachers when they can just say, hey class, I'm not having a great day today. And when they hear, a teacher normalize that every day is not going to be your best day, but you still have to find a way to work through it. You can talk to somebody, you can reflect, you can journal. There's different ways you can process things. But then when they see something that appears more consistent, more elevated, more intensified, then you send that to your next level of care within the school, which is the school counselor, who hopefully has that relationship with the family and can reach out to them and say, hey, I realize that X student isn't having a great day today, and I wanted to share that with you. Is there anything else going on at home that we need to be mindful of? And here are some supports in case you wanted to have them speak with someone who could give them a little bit more attention than we can here at the school.
And to follow up on Daryl's point, relationships matter. And it goes to, it's relationship building is the premise of the foundation of mental health treatment. And so if we're only thinking about outreach when there's something bad, how do we even have the space to have meaningful conversation? And so it goes all the way back to how schools engage families. And I know that racism is in the title of this presentation, but it also affects those family-school partnerships and who's invited to come in as a guest into the school and as a meaningful partner in their child's education. And then some schools who are just doing one-way communication, that it's the school communicating to the families and it's not the other way around. And it needs to start at the beginning by really focusing on that parent and family engagement to create that solid foundation to have discussions about what is going on with kids, what's happening, what may be happening at home that's impacting kids' learning, or thinking about emotional problems or stressful situations that are occurring that's going to have an impact on the child's performance at school. And so we have to create and open those doors and really break down those barriers, as well as acknowledge that families are the experts on their kids. And so we hold a lot of knowledge and expertise when I think of when I see everyone here on this panel, but we also have to think about our families, and that we can't just talk at them and thinking about what your kid did wrong and they have to do X, Y, and Z, but really inviting them into the conversation about, well, how can we address this? What do you think works? And engaging in that broader problem solving within that relationship.
Right. And I think that also, so as a single mom, when people hear that term, they all sorts of biases and ideas come into their mind when they think of, here I am supporting my child, by myself. And that, you have to think of the biases that come about. I did a school visit back in November, and I was sitting in on, because I was acting principal for the day, and I was sitting in on an IEP meeting. And the staff member that was running it and the parents, they did not, I don't even know if they were aware or they didn't get the message or something else. And they're just kind of like, oh, well, they're not involved. And, and there's all these biases around working around, especially families that are impoverished and not recognizing, and kind of like this whole blame the parent. You see this on social media and so forth. The folks blame the family, blame this, it's all the parents' fault why these kids are here. And like, no, that is not helping to build relationships. That is not helping to talking about family engagement. When you're all of a sudden the staff and and the principals, the messages that come from, like, those are great. But the problem is that the languages that come from the staff in the schools when the administration is not around, and those biases that are there, how can we break down those concerns that are there as to why families may not engage? And maybe because they have 2 to 3 jobs. And if you have 2 to 3 jobs, are you going to be able to sit there and come to a PTA meeting or be able to participate in parent nights and all these other things that are going on? Probably not, because you're worried about your food, clothing, and shelter for your kids. So we have to think about these biases and how this impacts, because that same bias that I see staff have toward families, they have that same bias toward the kids. And then they have these expectations that they're not going to do well, they're not going to achieve, they're going to end up, X, Y, and Z. So as we're talking about these relationships, we just have to keep in mind for all of our staff in our schools, how these perceptions are there, and also then recognizing your privilege. And that your experiences, kind of like what Ms. Palmer talked about in her video, your experiences growing up and how things were with your families and so forth may not be the experiences of others, but then also how are we going to understand our privilege, and how that is going to impact our feelings and perceptions of others, and how it's going to impact our feelings and perceptions of the families that we work with. Because until people hear, oh, I'm Dr. Connolly, then all of a sudden the single mom stuff goes away. But at first it's like, oh, and now these are the looks that I got. And it's amazing because, I mean, here I am, you know, like, hey, I'm the director of psych services. But the minute they saw a Black single mother, until they heard, oh, you work for MCPS, oh, you're the head of psych services. So let's just keep that in mind, especially for our staff that are sitting there and watching this, and as the work that we need to continue to do, because this is a courageous conversation, right? And so how can we continue to work with our equity office, with our OSFE, in terms of all of the work that is going around many of these topics, so that we can continue to grow in terms of how we interact with the families in our community.
To follow up with Dr. Conley said, I do think that there should be a way of how I think counselors should send newsletters monthly. I do think that principals, they do administration, they send out a lot of emails, weekly updates, usually on the weekends, about what's going on. But I think that'd be nice if counselors really do a lot of outreach to the parents in the community and send out an email at least monthly about what updates they're doing to the department. What are they doing as far as planning events like mental health days, things like that. I think that we should keep an eye out, and I think that this is what the counselor's department should do, is have a better relationship with the parents, and this is one step closer to doing that.
Ava, I appreciate your comment there. It's almost like you were in my head. There was a question earlier speaking to that point, especially during this current time, right? We went through a continuity of learning and ended school year early. We're currently in the midst of summer and about to start, for many of our students, summer school or summer boost. And then, of course, we're not still quite sure what fall will look like. So I'd love to hear more from the students. And of course, Ava, you've shared your piece, which was excellent. But also from any of the professionals. How do we establish, how do we grow and nurture a relationship with students that we might not see in the next few days in the same personal space, but through this virtual space or through online learning, and during this time where there's a lot laying on our students beyond the uncertainty of school and the race and the social justice compounding that as well. As our last question for the panel, what suggestions would you give for MCPS during this time to help assist our students and nurture these relationships?
For us at the beginning of remote learning, I remember my English teacher had like a weekly Zoom that was not related to class content, and she would just check in on us. We'd have a conversation about the books we're reading, the Netflix shows we're watching, and it was just a very relaxed Zoom. And I know that helped us continue to develop our relationship even though we weren't seeing her in person.
I agree. I think that's a great stepping point of having. I think we should do that throughout the summer because we are away. We're not in contact with a lot of people. Not a lot of us are really going to summer camps or doing things outside of just preparing for the next school year. So I think that maybe the different middle schools, high schools, elementary schools, they should host Zooms and just lunch check-ins, maybe once a week, just check in with their students in the community of their school. I also think that we should have more counselors and more psychologists that look like us, like that are people of color, so that we could see someone who looks like us in order to resonate with who we are, and that we can let our guard down and really just open up to about what we're going on, because I feel like they're going to be more comfortable if they see someone who looks like them. So I think those are the two vital things I think that we should do.
All right. Well, we are out of time, I want to thank our panelists and Shella, Gillian, and John for your time, for being with us today. We had a great conversation around so many different themes tonight. I'm just so thankful for all of you who are watching us via Zoom on the website or streaming on YouTube. And so we want to make sure that people have access to resources that are available. If you go to our Waymaking special website, you will see links to mental health resources that are available, to additional Waymaking videos. If you're interested in learning more about mental health topics, you can also go to our race and equity webpage in order to learn more topics around that as well. And again, we just want to remind the audience of the resources that are available for reporting incidents of discrimination that you or your children are experiencing here within MCPS schools. And last, I want to make sure that any information we have in terms of our evaluation for this event, we will make sure to place onto our Waymaking special webpage. And so again, I want to thank John, Shella, Gillian, and our expert panel, and those of you who submitted videos for your time to be with us today. And we want to thank our viewers for joining us for Waymaking. To send us additional questions and topics to discuss on future shows, please make sure to go to the Waymaking special link and fill out the survey. Please go to our YouTube playlist to find additional shows in our Waymaking series. This events program was also live streamed on YouTube and will be available for playback as soon as we hit the stop button. So, and also don't forget to subscribe to our MCPS TV YouTube channel and follow us on Twitter for more programming and updates from MCPS. And please join us next time on MCPS Waymaking.